The Sarasota County Eldercare channel is brought to you by Mike Levine and the great folks at Home Instead of South Sarasota County. Today's guest is Dr. William F. Bennett, orthopedic surgeon with Bennett Orthopedics and Sports Medicine.
Good afternoon. Hi, it's William Bennett here, Dr. William Bennett. I'm an orthopedic surgeon here in Sarasota. I thought I'd tell you about some exciting things that is occurring in orthopedic surgical practices around the country, and specifically right here in Sarasota. I'm an orthopedic surgeon who's been practicing for about 20 years in Sarasota. I have offices in Sarasota, Bennett, and Bradenton. I do minimally invasive surgery on the shoulders and knees, total knee replacement and total shoulder replacement. I'm an expert in rotator cuff repair, and more recently, since about 2006-2008, I've been evolving the practice to introduce some exciting non-surgical treatment therapies for patients with musculoskeletal injuries. These injuries not only occur injuries to tendons, but are chronic injuries like arthritis of the knee, arthritis of the hip and shoulder, tennis elbow, golfer's elbow, cartilage damage, and many other types of musculoskeletal problems. What I've been doing for the last 8 to 10 years is introducing some material from your own body that can help you heal. Mainly, there are two sources to this. One are your platelets, which are found in your blood, and another source are stem cells, which come from your bone marrow. Most people don't realize that we all have stem cells. In actuality, stem cells are found in all of our tissues, even brain tissue and heart tissue. A good source of stem cells for reconstructing and repairing tissue, an arthritic joint, or a tendon injury like a rotator cuff repair, come from the bone marrow. There are other sources that are used like fat. However, they're not as good for reconstituting cartilage, tendon, and ligaments. In essence, this procedure can be done either in an office setting, like we have here, and sitting behind me I have certain centrifuge machines that can process both the platelets and or the stem cells. Now, platelets are not cells, they're found in our blood, and many people who know about platelets associate them with a clotting mechanism. More importantly, platelets, when they arrive at a site of injury, give off messages to the body to heal. PRP stands for platelet-rich plasma. There's a process where I can take your venous blood just like you would in a lab, or if you're donating blood, right here in the office, we take it from your vein, it goes into a container and is placed into a centrifuge. That centrifuge spins the blood and isolates your platelet. The platelets are suspended in a little bit of your own blood. And using this machine here, which is an ultrasound machine, I can see injuries to tendons and the joint space, and the concentrated platelet injection is placed into the injured area. And oftentimes this concentrated message to heal is enough to halt and sometimes completely reverse arthritic processes. And at other times, they can actually help with the healing of certain tendons, whether that be an Achilles tendon, patellar tendon, or rotator cuff tendon. That is also utilized with certain surgical procedures that I do in the operating room. I associate platelets with arthroscopic or minimally invasive rotator cuff repairs, and oftentimes with a total knee replacement to allow the tendon to heal much quicker. The use of platelets and or the stem cell procedure accelerates the healing, and oftentimes I find that it cuts the physical therapy or rehab time in half. The other procedure that I do also in the office, and also I do associated with certain surgical procedures, is a true mesenchymal stem cell procedure. I said stem cells are in all our tissues, even our blood, and some people would say that a PRP injection is a stem cell procedure. It is not a mesenchymal stem cell procedure, which comes from the bone marrow. Those stem cells can also be utilized to treat the same conditions that I just talked about with the platelets. And in fact, the bone marrow is processed in the same fashion as the platelets. It's done under local anesthesia in the office. It's spun around in a centrifuge, the cells are identified, and again I use the ultrasound to place them into the injured joint or a tendon injury. And I add concentrated platelets to it, which are the food for the cells. It's a more extensive procedure, but it's still in the end only an aspiration of bone marrow and an injection with a needle. The procedure can also be done with certain surgical procedures like minimally invasive rotator cuff repair. Oftentimes I've associated the cells with the repair, and there's a mechanism intraoperatively that I use where I activate it and I can turn it into a healing gel. So not only are the stem cells and or PRP injected into the tendon, but then the repair site is coated in what looks to be like jello in actuality. This accelerates the healing as well. With stem cells added to certain rotator cuff repairs, I've seen reductions of about 60% in time for rehab. We have very high success rates. It doesn't work in everybody, but the success rates across all injuries are quite high, and this affords certain patient populations to potentially avoid surgery, to include total hips, total knees, total shoulders, even some types of tendon tears. We have a number of our patients, you can see on our website under the testimonials, that are elderly, 80, 90 years old, that have avoided a need for a replacement, a knee replacement or hip replacement with this type of procedure. And many people, above 80%, are satisfied with the procedure. Please visit us at our website, BennettOrthopedics.com, or give us a call 953-5509.